I'm a pediatrician, so what I'm going to do tonight is try and talk to you about this totally from a pediatrician's perspective. So I can't really speak to the health of the adults, and I feel like the risk assessment I also should leave to professionals in risk assessment, but what I can speak to is the health of children. And so I want to give you a developmental perspective on asphalt plant pollution, which is air pollution, and really try to give you a better sense of how development plays a role in how we consider environmental hazards. So to begin with, it's a little bit dark, but you guys know Petaluma, obviously, and it's just a picture showing you where the plant is and then putting in place a few of the nearby residences, a few of the nearby parks. And let's see. Oh, sorry. Hang on. Okay, so what I think we should do tonight is think a little bit about kind of what's our key question around this plant in terms of health. And for me as a pediatrician, my question would be, does it make sense to add a source of air pollution in this particular area? And so this is just a little something a 6-year-old patient of mine said, which is, when trucks go by, I hold my breath because it's so bad. Sometimes if there are lots of trucks, I just try to take little breaths. And this is just sort of a humorous perspective on how we should handle air pollution. It would be, if it were that easy, you know. And so my key points tonight, I'm going to talk about children and fetuses and how they're vulnerable, sort of the basics of organ system development. I don't know how many physicians we have in the audience, but just kind of give you a little bit of background on that, the way the air pollution poisons these systems, and a little bit about the pediatric medicine preventive approach to taking care of children. So the key areas that children and fetuses differ from adults, and why I'm here, is that behavior, they're completely different, right? We all know that. And if my children were here right now, they'd be on the floor, they'd be tossing things on the ground and causing all kinds of trouble, which none of you are doing, thank you very much. So, but they have more play, they're more active. Physiologically, they actually take in more air per minute than an adult does for their body size. They don't clear toxins as well, particularly when they're fetuses and when they're infants. And that's to do with the point in development at which they are and their ability to clear toxins at that point. And they're more susceptible to genetic damage and resultant cancer because of that. Consequences in children, when you affect their developmental systems that are growing and changing, can be lifelong. So you can have something that a children is exposed to, even in utero, that affects their risk for diseases that we only see in adults, we don't see in children. So I'll talk a little about that. And then developing organ systems have these critical windows of susceptibility. There's points at which, if you interrupt it, you have a worse outcome. So kind of going along this stream of thought, air pollution can lead to developmental disruption, which can lead to disease. The primary diseases that we think about with air pollution are asthma, allergic disease, emphysema, cancer, and heart disease. And this occurs because these exposures happen during these windows of susceptibility, and those cause either a structural change or a cellular change or a genetic change. So how does the body develop? I mean, what are the fundamentals? Why are we programmed to become people? How does that happen? And that's the fascinating field of embryology. But when you really get down to why that occurs and how that occurs, there are these built-in signals that tell the developing fetus to develop in a very specific way. And those signals can be physical and those signals can be chemical. And the physical signals are simple things, like, you know, a woman when she's pregnant, she has that fluid in there with the baby, and if that fluid is low, that can impact the development of the lung. So that's a very physical signal. You have to have adequate fluid within the womb for that baby's lungs to develop properly. There are chemical signals as well that are working at sort of the lung level, talking between the lung, the muscles around the lung and the areas around the lung. And these signals all occur in a very predictable way, in a patterned way, and in a sequential way. So here's a picture of the developing lung, and not to confuse you, and don't worry about the writing really, but what it shows you, each line there is a next stage in fetal development. It starts out with the really dark red at the top. that is 4 to 7 weeks. And just imagine the lung is like a tree. I mean, if you've seen a tree, it starts out, it has one trunk, maybe 2 branches. That's the beginnings. And then those branches branch, and you have 2 more. And then they branch again, and they branch again, and they branch again until you have a full-grown, mature tree. And in the lung, when you reach about 36 weeks, so about 4 weeks before the baby is born, the lung is at the stage where it's really starting to develop all these sacs at the end points of all those branches. And those sacs are critical because that is how the body is going to be able to take in the oxygen and remove all the waste products from the blood. And so that sac development starts about around 36 weeks of gestation. Baby is born, and then it continues. It doesn't stop when the baby comes out and takes their first breath. That actually continues throughout early childhood, very fast during early childhood, all the way through to early adulthood. And what's important about this is that if you imagine an exposure to some kind of a toxin at any of these particular times, you can imagine the kinds of effects it would have. So it's just sort of a logical thought process. And this is sort of the beginnings of scientific inquiry. You know, why do we even think it matters if a toxin comes in and gets near a fetus? Why does it matter? Well, it matters because what happens if you interrupt this to the full-grown adult? Or what happens if you interrupt this somewhere to the 8-year-old? And so just sort of making the point about what ongoing lung development occurs after the baby's born, you get about a 10-fold increase in those number of sacs between birth and age 4. So that's a pretty significant amount of change. You get about a 20-fold increase in the surface area, so the sort of the amount of sac surface you have from birth to maturity. And that's important for how able the body is to take in oxygen and remove toxins that are important. Sorry, not remove toxins, remove waste products of living. So how does air pollution disrupt this development? You know, why do we even think it might? Well, lung toxicity we've found actually weakens the structure and function of the lung. And these are based on, you know, the beginnings of this understanding comes from animal studies. That's where we begin. You know, you can't go and say you have an idea, you have some inquiry about how this works, and then sign up a bunch of kids to cut them open and take out a piece of their lung and have a look at it. So you start with animal studies, and that's the early stages. And it evolves, your knowledge evolves, and you go from, you know, simple animal studies to more complex animal studies to primate studies to eventually you're doing more human studies. And as you better understand it, you better understand ways to ask the question, ways to find out. So you know, some of what I'll show you is animal studies, but we're in this process of learning. We're in this process of understanding. So in lung toxicity, we actually found that air pollution weakens the structure and the function of the lung. The structure, that's mainly based on animal data, although there's now some more recent human data that is non-invasive, giving us an idea that the structure is actually changed in children when they're exposed to diesel. And function, which is all in human studies. So we know that the structure and the function of the lung change when children are exposed to diesel emissions at an early age. And that change is permanent. You know, so this is epidemiologic studies, as Dr. Weil was discussing, really can give us so much information, are so important, particularly in the case of children. And that's what we've learned. So we also know that some of the air toxins in diesel emissions can weaken the ability of the lung to repair itself. That's the lung toxicity. So that's one organ system. The other organ system I want to bring up tonight is the immune system. So there's also some immune system toxicity where the toxins in diesel emissions actually interact with your genetic code. And in developing immune systems, it can interact with the genetic code in such a way that it can program the body to go down a certain pathway in their immune system, a pathway for allergy. So it makes them more prone to allergy.